So laborist programs are a growing concept across the United States, and for many reasons. But primarily, it comes down to quality of life for physicians and their families, and work-life balance, and it allows us to individualize and yet kind of divide and conquer as a team.
It does.
Where your passions are, where your strengths are.
And it's better care for the patient.
Absolutely.
I spent probably 12 or 13 years solo in practice, and I think you did too.
We've all been there.
We've
all
you're
been in
pulling
solo
call
practice.
and you're 24 hours a day, 365 days a year. Yeah. And it's not that you don't love it. I love my patients. I love my practice.
Absolutely.
But I think that patients deserve well-rested providers that are going to provide better care, and that it's just a safer concept to me.
Yeah, and I always, when that comes up, that discussion with a patient, when that comes up, and I not only welcome them, but I actually challenge them to look up the information I'm telling them for themselves if they don't believe it. But a sleep-deprived healthcare practitioner is the equivalent of a drunk practitioner.
Agreed.
Right? Our minds are slower, our thoughts are more jumbled, our physical dexterity is slowed. And I just say to them, would you ever want a drunk physician delivering your baby, doing your C-section, or doing your hysterectomy? And of course the answer is no. And I'm saying then you also don't want a sleep-deprived physician doing it either, or nurse practitioner, or midwife.
If you look at if you really look at the amount of complicated patients that have multiple comorbidities, multiple health issues, this specialty is getting harder. It's can be difficult because the amount of complex care that we provide has grown even in the 13 years I've been here.
Absolutely.
It's grown.
Mm-hmm. Absolutely.
And I really feel like that having a group that discusses that care and that can hand off and hand their patients to someone that is rested and has a new perspective is advantageous to those patients.
Absolutely. And not only is the laborist model has benefits, the top of which is better patient care. We at Missouri Highlands, we're taking it a step further with collaborative laborist program, and by that, having both a certified nurse midwife and a physician on call for that 24 hours. Patients have everything available to them from a low intervention, unmedicated childbirth, vaginal delivery, to an emergency C-section, and everything in between, whatever is needed, indicated, desired. So the collaborative piece adds another level that Missouri Highlands is providing to the women of this community.
Right. And to be able to take that patient when she comes in labor, and if it doesn't go like we think it will and we end up in C-section, to have that midwife to be able to go through the whole process, even through the assisting in the surgery, I think gives that woman
continuity.
It gives her that continuity so that she feels better. She knows she has faces that she knows through the whole thing.
Absolutely.
Yeah, I think even in this day and age where you see, women should demand to have complete care, and it should be a shared decision-making model where we provide risk benefits and try to give them the birth experience they want in a safe zone.
Absolutely.
You've got to have it in a safe zone, and they have to be aware. But instead of it being something that they feel like that they're not being listened to, or that their needs and desires are not addressed, I want to see that change, and I think this is how we do it.
Well, this is absolutely how we do it, because I'm the first to admit, as a physician, that many of my physician colleagues, none at this table, of course, but many of my physician colleagues will not admit that there is a growing body of evidence that shows and proves that when a midwife is involved in an obstetrical case, women have better health outcomes. Their babies have better health outcomes. Women have better satisfaction surveys. There's less C-section rate, less complication rate, shorter stay in the hospital, less cost of care. I mean, pretty much anything you look at to track how helpful it is a positive when you have midwives involved.
You know, you could really further expand on that by saying that that there's a definite growing role for doulas as well, because
Absolutely.
you know, as a provider, you're whether you're in the clinic or you're on 24-hour hospital call, you're responsible for multiple patients, whereas a doula is like a one-on-one situation where you could support them, and it's not even just for, you know, labor and delivery, birth experiences, but also peripartum. So
Sure.
for postpartum, when you know, we really want to make sure that we're screening for postpartum depression, or whether they're bleeding too heavy, or different issues like that. So growing roles in that, that I think hopefully we can integrate at some point, but we're starting with you, Claire.
Yeah.
Okay. And we're so happy to have you.
Yeah.
Thank you.
And
Thank you. I'm
hopefully
happy to
that
be here.
keeps expanding as well.
Absolutely.
And,
I mean, our vision, I mean, although right now, with just the two of us as laborists, you know, we're covering the weekends, but our vision as a group and as Missouri Highlands and for the women of this community is to have teams of 2 the entire week.
right.
You know, so a doctor and a midwife every single 24-hour shift, so that you have that same spectrum of care available.
And we've worked in those situations a couple of times in the last 20 years, and they work well. When
They
you
work very
team
well.
up a midwife and a doc, they work well.
And then you pair it with like-minded individuals
Exactly.
that are
That's
providing
critical.
the same evidence-based care.
Yes.
The handoff is essential, and then the patient really should experience less trauma because they have a new oncoming provider.
Right.
Yes.
And in introducing this and making sure they see our faces and our names and what our overall goals are is really
Right.
important.
Absolutely. Yeah. Practicing in a similar manner, using evidence-based medicine is absolutely critical, and you know, having those discussions and those handoffs, and you know, because when you have different people involved, there's going to be different communication styles, and you know, there's more than one way to get from point A to point B, and you know, Dr. Gibbons and I might both be going from point A to point B by slightly different routes, but ultimately we're going to get to the same place. And so, you know, to be on the same page so that there's less confusion for the patients, and just because her path is slightly this way and my path is slightly that way, we're going to end up in the same place, so that they understand that we're doing the same thing, getting to the same place, and ultimately looking for that optimal maternal fetal outcome. Exactly.